Hello friends, I'm Dr. Preeti Yadav. I'm a board certified plastic surgeon and today we are going to talk about bat ear or prominent ears. So bat ear or prominent ear is a condition in which your ears are more projected outwards and this looks odd and usually it becomes a reason of bullying or low confidence. So this condition is congenital and one ear is usually more prominent than the other ear and that's quite normal. So how it can be corrected? So first of all, you need to understand that it's a correctable condition. You can treat this with a simple surgery, and this surgery basically involves an incision on the posterior side of your ear so that it won't be visible after incision. If your ear cup is deep, this ear cup is called concha, then we remove a part of this ear cup, and sometimes in prominent ears or bat ear, what happens, this antihelical part is less developed or underdeveloped. So if this is the condition, we will recreate the antihelix part with the help of scaphoconchal sutures. So likewise, because our ears are more projecting outwards, and after that we use conchomastoid suture to recreate the ligamentous structure of ear so that your ears becomes inward. So this surgery basically have 2-3 important things to do. One is to creating the antihelical fold. If your concha is deep, then we reduce the size of concha, and of course most important is conchomastoid sutures. So if you are an adult, this surgery can be performed under local anesthesia, or if you are a kid, this can be performed under IV sedation or general anesthesia. This surgery usually takes 45 minutes to complete and it's a daycare surgery. You can go home same day. After that, you need to wear a headband for 1 week or so. After surgery, we will be using a dressing. That dressing will be removed on day 5th. After removing that dressing, we will advise you to wear a headband for 1 week or so. With this surgery, you can get rid of your prominent ear or bat ear condition. So if you are suffering from this condition or anyone in your family is suffering from this condition, please contact us. We will provide you best of care. Thank you.